So atrial fibrillation is the most common arrhythmia and it in fact is one of the number one causes of hospitalization in older patients. And what it involves is basically the upper chambers of the heart, which are the atria, they are beating very fast. The most important sequelae of atrial fibrillation is that it can lead to stroke. So because of that, I think it's very important to address that issue in these patients. So the LARIAT procedure, the patients, as I mentioned, with atrial fibrillation have a high risk of having stroke. So the way we prevent stroke in these patients is give them blood thinners. But there are some patients who cannot take blood thinners or who have bleeding on blood thinners. So that's one of the reasons they can't get them. However, they're still at risk of stroke. And it's been shown that 90% of the stroke comes from a structure in the left atrium called the left atrial appendage. The LARIAT procedure is a procedure which is designed to percutaneously go and tie off the left atrial appendage. And if you do that, then you can exclude the area in the left atrium where the clots come from that lead to stroke in patients with atrial fibrillation. So the aMAZE trial is designed with the idea that patients who have persistent atrial fibrillation, that is atrial fibrillation that comes on but doesn't go away by itself. In those patients, we believe that apart from the pulmonary veins, there is something else involved in maintaining or sustaining atrial fibrillation. In other words, the properties of the left atrium have changed. So the aMAZE trial is an attempt to see if the left atrial appendage also contributes to maintenance of atrial fibrillation. Because one of the advantages of using the LARIAT procedure to tie off the left atrial appendage is that you also cause electrical isolation of the left atrial appendage. So this trial is a randomized trial in patients with persistent atrial fibrillation where they are randomized to the standard therapy, which is pulmonary vein isolation, versus pulmonary vein isolation plus the LARIAT procedure, in which they are undergoing isolation of the left atrial appendage. And after this randomization, the idea is to follow these patients long term, at least 1 year, and see whether there is a difference in outcomes. The hypothesis is that based on previous studies, non-randomized studies, that the appendage might contribute as much as 20%. And so you could have an improvement of outcomes in terms of maintenance of sinus rhythm up to 20% in patients who are undergoing LARIAT and pulmonary vein isolation over the pulmonary vein isolation. There has been no large-scale trial to address this issue, whether this improves the efficacy of maintenance of sinus rhythm. So this, I think this would be sort of one of the largest catheter-based trials to address that issue. If it does, then it changes the standard of therapy for these patients. And it offers patients a mechanical way also of excluding the left atrial appendage. Anytime we are able to offer some new therapy to patients, which we believe can change the outcomes, I think it's always very exciting to be part of that and to make a change. And if this changes the standard of care for these patients, I think that's a huge thing.